Hello, friends. Have you seen the headlines that all the pediatric hospitals are totally full and they make it seem like it's an absolute crisis? Not that it's not a crisis, but they're just kind of like going overboard. Things like this Michigan Pediatric Hospital experiencing a surge in capacity, and all the ones that are like, oh my gosh, everything is chaos. Today, for once in my life, I'm going to come on here and tell you that it's not that it's not chaos, but it's not as chaotic, it's not as bad as we think, which I know is a very odd take for me to have since I'm usually the catastrophizer. Welcome. Today we're going to be talking about RSV and how it is going all across the world, really. It's much more than we normally have. It is filling up pediatric hospitals, but it's not quite the catastrophe that I think the media is making it out to be. And we will go over why. I am a former pediatric nurse. I worked in peds for many years. I know very intimately one of the hospitals we're going to be talking about. And this happened. So I feel like we can talk about it and like I have some interesting insight, hopefully, that we can discuss this with. Welcome. Also, sorry I'm late once again. Every week, probably late for something. This time I logged myself out and I couldn't figure out how to get in because I was logged in for a different, like for my daytime job and I couldn't get back in and it was a mess. Also, yes, I still have COVID. I will probably I also couldn't find my cough drops. That was my other problem. And we are not going to stop without these, which are the best. Oh, my green screen's doing it. Ricola, Swiss Alpine Herbs, Lemon Mint, sugar-free. I don't know why the sugar-free. Normally, I don't do sugar-free because if you know about eating a lot of sugar-free things, you will never stop pooping. But for whatever reason, that flavor tastes better. Anyway, now that I can taste, but that was a long intro. Let's talk about the cases. Then we will discuss a little bit about RSV in general and how to keep yourself out of the hospital. So hopefully you don't have to be one of the people that is stuck in the ERs dealing with RSV. Don't forget, I like this. Don't forget, obviously like the video. Each like is like a cough drop for me, and it's the best. So there we are. Welcome everyone in the chat. Neuralia, hello. We have CK Medic. Oh, we have the whole crew. J. Michael, hello. CK Medic. First Cow. Hello. Mr. Midwife. All the people. Lola. We have Sal S. My sister is here. She has to be here. Scott is right. I'm always late. It's a personality. I call it a feature. It's not a problem. It's a feature. We love it here. So here we go. And Aurelia's got us. She's going to ban all the bots that try to invade our chat with our nighttime chat. And Amanda says, can we talk about adult RSV? I've heard that was a thing. You can get RSV at any point in your lifetime. We will be talking all about it. I'm going to go over the two articles first, talk about how some of the stuff is a little bit sensationalized, what is true, what is not, what is normal. And then I'm going to do a little bit about RSV, and then we'll do a whole Q&A at the end. YouTube has a new Q&A button that I'm dying to check out. So we're going to use that later. So if you have any RSV questions, you can type them in now, but they may get lost and never answered, or you can wait till the end, and then we will have RSV questions. And if you're watching this on the replay, hello, welcome. You can ask RSV questions too, and I will go through every now and then and answer all of them. So there we go. We will do that. And there we go. All right, let us do this thing and get going. Where'd it go? Leaving. Night shift has more fun. We'll see how long my voice lasts. Last week, it did not last that long. I think 21 minutes. It was probably everyone's favorite day. They're like, thank goodness. Shannon Schmidt. This is helpful too. If you guys work in peds, if you work anywhere that deals with peds, let me know how this is hitting your communities. Sharon Schmidt words said, I work at Lori Children's in Chicago, and we are swamped at our ED and immediate care. Yeah, I think winter is always a really busy time in Children's Hospital, and this one is especially bad. You've been seeing a lot of talk in the news about how RSV is so much more prevalent this year. It is basically because RSV, all of the people, we wore masks, right? And this is the first fall that we haven't really masked, right? And so usually everyone gets RSV. Kids, adults, everyone's usually introduced to it by the time they are 2 or 3, and they get it. And this time, unfortunately, it's hitting all the people that didn't get it like all at once. So we're seeing a lot more numbers because a lot more people are getting it, and the more people who have it, right, it's going to spread more. right? Because the more people who have it, the more people who are contagious, if that makes sense. So let us start with the first article. Like I said, I don't ever say where I worked on the internet, but I might have be very familiar with this hospital. Michigan Pediatric Hospital experiencing capacity issues amid an RSV surge. RSV seems to have emerged earlier this year and in higher numbers, says CS Mott Children's Hospital COO Luann Thomas Edwald. So usually we will see, in case you're not familiar, RSV in general is respiratory syncytial virus. It is a virus that is it's around the whole world. We're going to talk about the signs, symptoms, all of that good stuff later. Usually you start seeing it in like September, it swoops in. Peak is in like January, maybe February, depending on it, depends almost on your state too. And then it kind of goes down, but winter is the worst. Every year you see hospitalizations for it, but this year is particularly bad. Again, we have so many kids that are getting it and kids get it worse, right? So hospitals in Michigan are feeling the strain due to a recent surge of respiratory syncytial virus cases, or RSV. I think hospitals all over. Again, in the chat, let me know if this is something that you see like in your area a lot, or your hospital's dealing with this. CS Mott Children's Hospital in Ann Arbor, Michigan told ABC News that it is at full capacity a few weeks ago, which had staff worried, as they also expect an influx of children coming in with flu or COVID-19 symptoms during the winter season. This is pretty accurate. I mean, normally you are a little bit worried in the peds world. Particularly in the winter, hospitals are packed, right? I feel like they forgot to kind of mention that this hospital in particular, I can't speak to all other peds hospitals, they always get full in the fall and in the winter. We would very often hit situations where we were at capacity, like frequently. It was not uncommon for us to be like, oh, we're full, and have a bunch of kids sitting in the ER in the winter season, which stinks during cold and flu season, because there were a ton of kids. You would have, I worked on a cardiac unit, and you would have to cancel cases. That's another article we're going to talk about in a second. They would literally have to cancel cases because there were not enough beds. There were no ICU beds, or there were like for these kids to come out of the OR too, because they were filled with kids with RSV. And so there are a lot, but a lot of places, and I'm not saying this isn't an issue. I knew what I was talking about. I was like, oh man, everyone's going to hate me. I'm not saying this is not an issue. This definitely is. This is especially hitting, I feel like, community hospitals really hard, who have a very small pediatric unit, right? Who don't have an influx of other peds staff to be able to step in and handle it. Because there are more cases. They are very, very full with children. But if you think about it in terms of in a children's hospital, right, you have a lot of other people who you can kind of pull, who have at least handled a child recently, right? You might work in the OR or the PACU. And so maybe you're not quite as up to date with like peds, respiratory viruses, but you've dealt with a child. I think this is going to be a bigger issue going into when community hospitals, where you're pulling staff, the peds unit is like 5 beds, right? You have like 5 nurses that handle the whole thing because there's like no kids. That's much harder to pull an adult into a child situation. And so I feel like that's just, what they're making it seem like, oh no, this is like chaos absolutely everywhere. And for once again, I said, this is not that it's not bad, and it's not that it's not full, but this is something we tend to see a lot here. And Salty C said, I'm at a community hospital and there's no peds unit at all, which is also common. We're stuck with that. We're stuck with because the other hospitals are not accepting peds transfers. So then this is where it gets really tricky, because you are then having to take care of kids, and you don't even have a peds unit. So that's where this becomes quite tricky, because these other hospitals are full. So they got full. They hit capacity a few weeks ago. I would say usually we started to get hit with capacity usually in like November was the first time. So this is earlier, but we're seeing RSV and all these viruses kind of like pop up earlier in the season, because I think everyone, like, we're indoors, we're not masking anymore. And so the masks might not have helped with COVID there at the end, but they were helping with other illnesses, other colds, other droplet type things. We have been 100% full. I think we're going on our 6th week, which is crazy if you think about it, because our 6th week would mean it started in September of being full. And RSV seems to have emerged earlier this year and in higher numbers. That's expected. Again, because we had so many years there of everyone being inside wearing a mask or being isolated, and RSV numbers were in the toilet. As soon as we remove that one thing, right, we stop isolating and we take the masks off, the numbers are going to come back, because this is a virus that it's endemic to our area, right? So everyone's going to get it, and we're going to see double, which is the problem. And like Ali Jo said, it's not just earlier, the numbers are much higher, and they're higher because we're seeing, if normally your hospital was going to get 500 admits for the whole winter, this year you would expect to see probably at least 1,000, if not 1,500, which is a problem. So you're seeing a lot more because people haven't had it yet, basically, and now they're getting it. The fact they're already full is concerning. Yes, it's concerning. Although CS Mott Children's Hospital is at full capacity, they're trying to make additional space to treat ill children by using rooms usually reserved for other treatments like drawing blood or adding extra stretchers in the single rooms. I never saw them add beds to single rooms. So if they're doing that, that would be different. We did often pull what we call sometimes you have rooms reserved for, like they said, like, oh, we only do procedures in this room, and they'll put kids in weird other, like, they're like closet rooms. They're the worst. My daughter has been admitted to one of those before because she was admitted during respiratory season and they were full. And it doesn't have windows. It stinks. But they do kind of like fill up the overflow areas. I'm sure many hospitals are trying to do that. I feel like adult hospitals have been they've seen a lot of chaos recently. And now it's kind of hitting kids because COVID wasn't quite as much in peds hospitals from what it seemed like, but here we are. They're also working with other community hospitals in the state to make sure there's other options for children who need to be treated. I think that's honestly the biggest thing that makes me concerned is, what about these community hospitals who never take care of kids because they immediately ship them to the peds hospital, and now they're having to take care of them. And Jamie, it's absolutely better than the hall. We had kids in the hall too, like not up on the units, but like in the ERs, they're absolutely in the hall. Ali said they're doubling up siblings now. That makes sense, actually. And we're boarding patients in the ER and some ambulatory clinics. So that's not good. If you're taking care of patients in an ambulatory clinic, which is like your normal doctor's office, that's busy. That's not ideal. But I do kind of like the idea of doubling up siblings, except for how you could get confused because they probably have the same last name. Mr. Midwife says they don't have a peds unit. That's where I think we're going to run into problems, friends, is a lot of peds has kind of become its own specialty thing and everyone's scared of them. So if you don't even have anyone at your hospital trained to deal with them, that's where we run into issues. So some of our community hospitals have some pediatric beds available. So we're trying to take a statewide approach to making sure we take care of these kids in our state. This is very common. This is called so one thing that hospitals do when they are reaching capacity is they do something called leveling. And that is you will try to make all the censuses on all the units kind of the same. You stop surgeries that are not absolutely necessary. You cancel them, which totally stinks, especially if you're a parent and you've been waiting for this surgery for your kid, and then all of a sudden they cancel it. They will do that. And then they will level throughout the state. So they will try to send try to figure out like, hey, you can go here. You don't really need to be here, right? You're not the sickest of the sick. You can kind of go here. And I've seen them transport kids around because if you just need like a nasal cannula, right, you don't necessarily have to be somewhere that is going to be able to provide much higher care. Let's just switch it around. Lola said, is RSV airborne or droplet? It seems like droplet. RSV is droplet. So airborne is going to be things. That's when you have to wear like the N95. So we were doing that with COVID. That's going to be other measles, things like that. TB. TB is going to be those are going to be a whole other even thing. But yes, it is droplet, meaning when you snot, it happens. Noralia brings up a good point. I can't imagine a hospital without peds having the necessary equipment. Child lungs and trachs are smaller. No, yes. Peds has a whole different a whole different slew of things that we use. And kids are just so different. Kids, the way they fall apart respiratory wise earlier than they will fall apart any other way. And if you're not used to looking at a kid, it's much different. I've taken care of adults and children. Adults slowly fall apart usually, and children maintain, and then tank. And it's kind of terrifying, especially, and I imagine that would be incredibly difficult if you've never dealt with children to then have to do that. And the way you take care of them is different because the things that are failing on a child are usually not the same as that are failing on adults. Your heart is usually one of the first things we're worried about. We're worried about some of your other organs. Kids, their organs are very resilient. It's those dang lungs because they work so hard to try to keep up, and then their lungs are like, I'm done, bye-bye, which is very shocking coming from an adult world. Let us see. So they aren't the only hospital that's obviously raising the alarm bells, like you guys are saying. A lot of hospitals are raising alarm bells. The University of Michigan Sparrow Children's Center also sent an alert on Friday that it was experiencing a shortage of beds amid a statewide RSV surge in cases. It was also said that parents should expect longer times in the wait room. In Lansing, the hospital noted it has a daily average of 60 new cases of RSV, nearly double from this time last year. And again, double is, I've seen a lot of, double is bad, yes, but I've seen a lot on the internet of people like, oh my gosh, like weird conspiracy things about why RSV is worse this year, when it really is just that this will usually hit most humans on this planet, and it's missed a few years, so we would sort of expect double or triple. So does it suck? Yes. Is it causing problems? Yes. Is it a conspiracy? No. No, it's not. And asking parents to do what they can to mitigate the virus, including washing their hands frequently. We are going to talk about, like I said, in a few minutes, other things you can do at home too to help your kid at home, and also signs and symptoms to look at. This is not medical advice. It's just random internet advice. Warning, but just, some friendly education of things that you may want to know if your kid has this, or if you're looking at someone, you're trying to decide like, am I worried, like, or are we going straight to the ER worried? We're going to talk about that because a lot of this too is our ERs they were slammed with kids with RSV, right? But they were also slammed with people who were bringing their kid in who were not emergent and didn't need to be there, because as a society, in healthcare in general, we've done a horrific job of teaching people how to appropriately use our healthcare system, right? The ER gets constantly used as like an urgent care or as a family medicine practice. And so hopefully we can do our tiny part to fix this today. Sparrow, so they're keeping kids in the ER. We're really trying to tell the community about the state of Michigan. Please partner with your pediatrician. Yes. And let's use our urgent cares as well, and only come to the emergency room when absolutely necessary. Exactly. A lot of, and this is like a multifactorial type of thing too, with like the ERs, because for a lot of kids, your parents work all day, your pediatrician's office is closed by the time you get home because you worked all day. Urgent care, the lines are insanely long, and it's actually quicker sometimes to go through the ER, which then snags down the ER, and it's like a endless cycle, right? But I don't want to make it seem like I'm just like, learn how to use the healthcare system. We don't teach people and we don't make it easy. So it's not, we could do a lot better educating. Other states like Rhode Island, Colorado, Texas, and Connecticut have seen an RSV surge. Pretty sure most states are now seeing an RSV surge over the past month, which has prompted hospitals like Connecticut Children's Medical Center in Hartford and Cook's Children's Medical Center in Fort Worth to take precautions to ensure there's enough pediatric hospital beds available for the children who need treatment. RSV cases are on a steep rise in the U.S., according to the Centers for Disease Control. More than 8,000 new RSV cases were detected by PCR and antigen tests. Those are just things you swab in your nose in the nation between October 29th and November 5th. That number is in no way indicative of how much there really is. There is so much more than 8,000 new cases, because almost never will you get swabbed for RSV. So keep that in the back of your mind when you're hearing about numbers for RSV, because if you are outpatient, Most places, like if you go to the doctor's office and you're like, oh, my kid has like these are all their symptoms. Most places, not all, some will. Most places will not have you even swab to see what virus it is. Maybe they'll check to make sure that you don't have the whole COVID thing because the treatment is the same, right? Hospitals will swab you because we want to know where to put you. We want to know what kind of precautions to put you on. We want to know, if we're starting to cluster kids, right? Sometimes you will have especially in the winter, you would have a situation where you as a nurse would only take care of RSV kids and someone else would only take care of norovirus kids and someone else would only take care of rhinoenterovirus kids so that you didn't cross contaminate as much. You know what I mean? So it's helpful for the hospital, but it doesn't really affect treatment. So whenever you see those numbers, just keep in the back of your mind, not that it's reassuring, but when they give you numbers of RSV cases, it's so minuscule compared to how many. I mean, most people this year are probably going to get RSV. Bad news. Bad news, friends, but that's the reality of the situation. Pediatrician Elizabeth Murray told People that the virus spreads similarly to COVID with coughing and sneezing. Yes. Signs that children may have RSV include a runny nose, fever. The virus could lead to more serious symptoms like bronchitis. Bronchiolitis is more like what we're worried about. We'll go over that later, but yes, which is, no, this is just wrong. Bronchitis is not when the smaller airways of the lung are inflamed. That is bronchiolitis, but it's okay. People magazine, you tried. Murray also said that newborn infants, especially those under 2, are more likely to become critically ill from the virus. And we will talk about that later, but that's because their air holes are smaller and they're easier to get clogged up. And yes, so overall problem, but have hospitals been full before? Yes. Can the bigger hospitals probably handle it better? Yes. It's the community hospitals that I'm the most worried about, but overall, yes, this is a problem. No, it's not a conspiracy. And the biggest thing that we can do to actually treat it is to recognize who is sick, who needs to go to the ER, and who can be managed at home and not bog down this system. But I also wanted to offer a tiny shrivel of hope too, that hospitals are, at least in my experience at this particular one, they're very used to the winter surge. This is a particularly bad winter surge, but I don't want you to ever not take your kid if you are really worried. That is not at all what we're hoping for. If you are really worried, trust your gut and take your child. They do triage still. So wait times might be very, very long for the hospital in general, but if you show up with a very sick child, they will be immediately taken back still. So I don't want people to think that like something horrible is going to happen in the ER, for example. Hopefully, I have typically not seen that in peds. Yes, that is happening in adult land because yikes. But a personal anecdote story of it. I had my daughter when she was an infant, had a very bad virus. The hospital was full. I knew it was full because I worked there. The ER was wildly packed. I knew that because I asked my friends who were at work and I said, how full are we in the ER? And they were like, there are so many, I forget, there were so many, 50 people in the waiting room. And they were still able, so they were completely packed. The waiting room was so full. The whole hospital was full. You could not get admitted, but I walked in with my child who was very, very ill appearing, and we were immediately taken back. So they will still triage your family members. They will still triage your children. Please still take them to the hospital. Wait times, that is literally the ER's job, is to figure out sick from not sick, who can wait and who can't. So please still take your children to the ER, even if you see these things about the wait times being long. If your child is very, very ill, they will be seen very quickly, right? At least that's what we all hope. Brittany Young says, I've heard here in Canada, those under 1 being at high risk. Is it actually under 2? Under 2 is where we see statistically worse issues happening. But the younger you are, the worse it is. So they might just educate in Canada that it's 1 and under. Here we do 2 and under because at older than 2, that's when we typically see less hospitalizations, less adverse events, less adverse outcomes. But 1 is definitely worse. 2 is a little bit better, but still worse. And then after 2, kids generally do pretty well with RSV unless they have another underlying condition. Montana Gal says my hospital can't triage in the ER. That's a problem. Does anyone else have that problem? That's like, isn't that the whole point of the ER? Don't most ERs, at least in my experience, have someone sitting at the front that triages really quick. Hey, what is wrong? And they will decide, yep, you can come right back, or no, you're going to have to go sit in the waiting room. And because the way hospitals work, and Nurse Scott can tell us. Scott, he worked in the ER. Does your ER's triage? The way I have experienced ERs is you go and you talk to the nurse really quick and you say, hey, this is what's going on. And they kind of make a mental list, right? Of like, okay, you're going to kind of go here. It's not like when you show up to a restaurant and you get put on a waiting list. The waiting list, your space on it changes based on how sick you are. Yeah, I thought triage is literally their job. So they should hopefully be triage. Good night. Have a good night, Jay Michael. Thanks for being here. Yeah, can't triage in the ER makes me nervous. Most places can still triage, even if they're very busy. I just wanted to say that because I saw some things on TikTok and it's like, don't even take your kid to the hospital. They're so full right now. Here's some things you can do at home with essential oils. And I was like, no, no. I mean, for some, we're going to go over it. But yes, they will be able to help you. They should be able to triage. I'm worried about Montana Gal's hospital. That's literally ER's job, is to triage. Our hospital is, Sharon said, our hospital is setting up triage in the lobby before even getting to the ER. That's what this one did, where I took my daughter, is you literally walked through the door and they had moved triage back from the rooms it usually is, because those were being used for patients. And they did it like in the lobby when you walked in, and they took one look at my child and they said, that is a sick child. Yes, unfortunately it is. Yikes. Nurse Scott says that's how they keep the stats in the ER. How many levels? 1, 2, 3, 4s, and 5s. Yeah. So I've never worked in the ER, but I am in my head. That makes sense of like, hey, you need to come right, that you would have a number system, registration clerk as a triage nurse. Yikes. So that's the situation here. And Montana Gal said there's no nurse to talk to. It's just a triage or a registration person, which is not ideal in most ERs, in case you're unfamiliar, if you haven't been, which congratulations. You walk in, at most I've been to, you're kind of like, depending how sick you are, I guess, because I have taken my daughter in and there's usually a triage nurse sitting right here. And then the registration people are right next to them. And if you are really sick, the nurse just walks over and goes, yep, come on back. Or if you are like me, if you are active, if you are, the color of nothing and just slumped over in your wheelchair, with barf all over you, they take you right back, usually. With a panicked husband. I've also been there when I and my children have been less sick, and they make you talk to registration first, and then you go over, but you can usually tell. That's how it is. So Scott says the registration clerk tells the RN that someone is there, and they don't make decisions usually. Ask me about the emergency severity index. That's a 1 to 5 scale. I've done papers on it. Scott, I feel like that's a video you should make. I would be interested in that. Okay, so there is our first article. Thoughts, feelings, mostly yikes. It is expected. I don't work in a hospital right now, so I don't know, like, were we preparing for this? Because I feel like 6 months ago, at least people that like at the healthcare sphere were talking about like, oh, this is going to be a rough cold and flu season. So hopefully some of them have had plans, because all of us, I mean us as in like Facebook groups and stuff that I'm involved in for like healthcare providers for children. We're like, oh, RSV is going to be killer this year. Not killer. Well, yeah, poor choice of words, Liz. RSV is going to be really bad this year because we're going to have all these people who, are catching up on getting it, coming in. And now we're seeing that. So I hope maybe some of these people like planned ahead. Maybe. Did we? Does anyone know? I certainly don't. So let's see. Here's our second article. This one I wanted to cover because it lets you kind of know how they handle getting their hospital less full, right? So pediatric hospitals, also heart surgery was my thing. Pediatric hospitals are very affected. So we remember that kids are highly affected by respiratory viruses, right? And their respiratory system is one of the first things that fails in children. So it would make sense that cold and flu season, respiratory system is much worse for children. In Peds world, your hospital is full pretty much all winter with all the snotty buggy things. And then it drops down and your census goes usually down in the summer, but you don't get a chance to really be empty because that is when all of the surgeries happen is in the or later spring, summer, and fall. One, that's because the hospital is empty, but two, that is also because that is when school is out, right? So kids who need surgeries that can wait, not all of them can wait, will happen in those times. And so that's how like children's hospitals like usually work. Adults are much more level, right? Adults are afflicted by a bajillion things. All of their body parts, because we're old, fall apart pretty equally. So it's a pretty much level playing field. Winter was particularly bad because of the flu, like respiratory things, but also the summer because everyone is trying to go out and enjoy themselves, which involves them doing stupid things and accidents and then dying. Fourth of July, all the things. So adult land is much more stable in terms of how this flow goes. And in peds land, the way they navigate cold and flu season is they just cancel a lot of their surgeries, which is very difficult. So even before their daughter, so this article is from CNN Health, desperate for heart surgeries for their baby, a family feels the effects of pediatric hospital shortages. And I cannot tell you how awful I feel for these parents who have mentally geared up for surgery for their child. Like I can't fathom that stress, only to get a phone call the day before or the morning of and say, hey, your surgery is not happening after you've like mentally prepared for it because they had to cancel because there was so much like cold and flu. I just feel so bad for those parents. Even before their daughter was born in June, Aaron and Helen Chavez knew they would need heart surgery. The doctor expected her to have an open heart surgery around 6 months of age. I wonder if I haven't read this before. I saw the title and I was like, I'll talk about that. Probably should have read it. We're going to bet. Does she have tetralogy of Fallot? Either that's my bet. Usually we do those surgeries around like 4 to 6 months. We see if we can get them to 6 months because we want them to be a little chunkier. It became apparent or whole. She definitely doesn't have anything too bad because you wouldn't wait that long. When it became apparent in September that it would have to happen much sooner than expected, the Chavezes said they endured an agonizing month of waiting for a bed to open in the local children's hospital so baby MJ could have the procedure she needed. That is just so hard. Oh, that stinks. They said, well, we would love to get her in as soon as possible. However, right now we don't have beds. Ugh. Space for children in the hospital is at a premium across the country. Data reports that the U.S. government shows that as of Friday, more than 3/4 of pediatric hospital beds and 80% of intensive care beds for kids are full. That's up from an average of about two-thirds full over the past 2 years. Again, this would be expected though, right? Because children mostly are hospitalized. Sick kids are mostly hospitalized for respiratory viruses, which we have been protecting them from by masking and social distancing them. And now we've removed that. So now they're all going to come back. They're all going to get sick, right? Federal data shows that the strain on the hospital beds for kids began in August and September, which is early. Usually you don't see that then, which is right around the start of the school year in many areas. So kids are going back into the classroom. They're in enclosed areas. That's going to spread all this stuff. Hospitals are seeing higher than normal numbers of sick kids, infants, and children due to a particularly early severe season of respiratory infections in kids, including respiratory syncytial virus or RSV and influenza. As of Friday, Golisano Children's Hospital in Rochester, New York, the facility that treated Chavez's daughter, was over capacity. Federal data shows that it has been consistently more full than the national average over the past few months. Golisano went from having an 85% of its bed occupied in August to over 100% now. Like many other hospitals in the country, Golisano has seen a sharp increase in children who are severely ill with RSV because, again, we're doubling numbers, right? If not tripling. Dr. Tim Stevens, the chief clinical officer, said 35% of the hospital's current patients, excluding those in the NICU, the neonatal intensive care unit, have RSV. That's a lot. That's a good chunk of, because you have to think who else is in the hospitals, all the other kids who have like, just normal like children who have cancer, who are there because they have GI issues, who are there because they have heart issues. I would say usually that's, depending on how big your children's hospital is, maybe that's like, a third in the winter. So maybe those numbers kind of, I don't know. Usually most in the winter, most of the kids, I would say like well over half are there because they're respiratory issues. A lack of available beds means patients are sometimes held in the emergency room to wait for a bed to open so they can be admitted. We do see that a lot. You see kids, they cannot come up to the floor until we get someone else out of there. And if they're still on oxygen, they can't leave. And we like to watch them for about a day before they can leave. It may also mean children who have chronic conditions and need procedures or hospital care, but whose conditions are stable may have to wait. And they really do try, in my experience, you don't have an emergency surgery put off. These are the kids that like can wait. I have seen them do some pretty impressive maneuvering in order to get emergency cases out. They make it work. That's what you start discharging people when they're like, you have to be off oxygen for a day to go home. And then all of a sudden they're like, well, you've been off for like 3 hours. I'm sure you're fine. Bye. I wish I was kidding. But I mean, you have to do what you have to do. A hole in the heart. MJ was born in June with, she was born with a VSD, of a ventricular septal defect. So you have, your heart has 4 chambers, 2 on the top, 2 on the bottom. The only ones that should connect are top to bottom. And in this case, you have a hole in between the bottoms, which mixes stuff. You can survive with that as long as your body handles the mixing of the blood. And you usually get monitored. So sometimes you can last like a little bit longer. Sometimes all of a sudden you don't start doing well. And you have to move up your surgery, which sounds like what this poor baby has. Doctors could see the defect on prenatal ultrasound. So that's when you go in at your 20 weeks. They could usually see your heart conditions then. Because MJ was never in the right position to get a good image, they weren't sure of its size. Funny story. I promise we'll get back to the real story soon. Piper, when I was pregnant with my second, they thought she had a congenital heart defect, which I was like, oh my gosh, because I worked on the congenital heart defect unit. So I was like, oh my gosh. They're like, but, and we can't quite see it. They're like, we think it's, and they wrote on the screen what they thought it was, like in their thing. They were like, this might be this. And it was a bad one. It was transposition of great arteries with like possibly this other thing, which is like when your plumbing is really messed up. And I was like, oh my gosh. They're like, I need you to like roll this other way because we can't really see her. And I was like, you think she has transposition? And they were like, oh God. They're like, oh, you read, you read the screen and you know what that abbreviation is. I was like, I work in congenital heart disease. They were like, oh no. They're like, well, we can't really see it well. But she's like really in the way. Did I go into that bathroom and do a handstand while however many 20 weeks pregnant? Have I ever done a handstand? No. Did I do one that day? Yes. Because they were like, she really needs to, like, you really need to annoy her and flip her so that she can do this thing. They were like, well, I was like, so how much movement are we talking? She's like, well, I mean, like, go to a handstand in the bathroom. I think she was kidding. I did it. I came back. She was in a different position. She did not have anything wrong with her heart. I felt very lucky. But don't do that. In hindsight, I came back. I was like, I am very dizzy. She's like, what did you do? I was like, I don't want to talk about it, but let's see if she moved. And she did. So don't do that. There's better ways. You can come back. you can always come back. Or do less offensive things to your body than stand on your head when you're 20 weeks pregnant. But that is when those are diagnosed. If they're small enough, the holes usually close on their own after birth, but the hole in MJ's heart was not so small, caused oxygen-rich blood coming from her lungs to mix with the oxygen. Mr. Midwife. I know. It was. That's how you end up in the ER. They're like, how did you do this? And you're like, oh, I just needed to know. And I put my hands on the hospital bathroom floor and survived. I had hyperemesis with both my girls, so I was no stranger to hospital floors and bathrooms and toilets. Okay, I have vomited in every bathroom of my children's hospital floor. Everyone. All the patient rooms, everywhere. Fun fact about Liz. But one nice thing was all the parents, we had a lot of babies on the floor. And so you could literally be like, I am pregnant. I am so sorry. I have such bad morning sickness. If I go and throw up in your bathroom, I will have it cleaned. I am sorry. And they were all like, oh, I've been there. I was just there. You're like, yes. So hospital floors, we've seen each other a lot. So in this case, this poor baby, was starting to not eat very well, which is one of the first signs that we see in babies who have heart problems, who are starting to not do as well. It's very common in babies with heart conditions, by the way. We don't educate about that a lot. A lot of parents have no idea. So if you have a heart baby or someone with a heart condition that is little in your life, they probably won't eat well. They will throw up a lot because eating takes a lot of energy. Um, and these babies, they stop eating. And this poor baby couldn't have surgery because they had to keep like putting it off because they literally didn't have an ICU bed, which stinks. We're not going to go into all the details of, like these are all the sad signs of waiting, but only to highlight that this is how hospitals handle it is they put off surgeries and they try to balance you like medically. Then they probably admitted the baby. Yeah, they admitted her. They were monitoring her, and then you kind of just have to wait. So just holding off on hospitalization or on surgeries is how they do it. So this is very hard. If you are a parent who is dealing with this and you are waiting because your hospital is full with RSV, I am so sorry. Like that is just agonizing. I hope this baby ended up getting surgery. Oh, good, they did. Good. They got the surgery, right? Did she get the surgery? She was in the hospital for 6 days after. Oh, that's really quick. Good job, baby. And is now at home. So they usually will still get you to surgery. Like I said, you get to a point where you're so sick that they will just do the surgery and they will figure out what to do with you afterwards. AKA they will take the healthiest kid from the ICU and send them to the floor. And then the floor, we get to argue with them being like, we don't usually take children like this. They were like, well, you are today. And that's where you run into safety issues is because you're like, this child, there's a lot happening here. I have way too many patients for this. And yay, that's what happens. So that's kind of a brief look at what is happening inside of our healthcare systems. If anyone has any questions, that's the big safety thing that makes me like, ooh, is that hospitals either won't know what to do with children because they normally don't see them, but now they have to. And that in order to accommodate the sicker kids are going to just get pushed down, right? Your ICU kids are going to go to the floor. The floor is going to be like, I don't like, I worked on a intermediate unit. It was like an intermediate unit / the floor. And we would get these kids. We were like, you should not be here. Yikes. And that's what we're going to be seeing. So that is kind of the status update. The only thing I can say that's not like panic inducing is that it is normal for peds hospitals to get full. They will still triage you appropriately unless you are at Montana Gals Hospital. Don't go there. Apparently they don't triage you. And if you really need surgery, you will still get it. But other than that, the goal is to try to keep your children at home. Okay. And that's what we've got. So, and if you have people, yeah, Mr. Boy, if we live through COVID, we can do anything now. Yes. And if you have questions, well, ask your pediatrician or whoever provides care to your child. I did this all the time with my patients and I wish they did it more. I was always like, not mad, but when I found out my patients went to the ER and they didn't even like call me, they were like, I wasn't sure if I should go. So I just went. And a lot of times it was for things where I was like, I can diagnose ear infections for your child, right? Like they were like, oh, I thought like this would just be quicker. I was like, your primary care provider would love most of the time. Love is maybe a weird word. Your primary care provider does not mind you calling them and being like, I don't know if I should go to the ER or not. We would love to help you triage that. Okay. Or the nurses that work in our offices. I didn't have a nurse. I was my nurse and my nurse practitioner. I was all the things. Sometimes I was an MA. I was the biller and the coder. Yay, private practice. You can always call them, right? You can always call them and just see like, hey, this is the very brief situation. And I can be like, yeah, you should go. Or like, hey, friend, just pause. urgent care or come here. But yes. Uh, let's see. Yeah. Neuralia said, during COVID, y'all had 15 patients apiece. You keep doing what you do now, right? For no pay increase. And if you mess up, you'll lose your license. Yes. So stressful. I do want to reiterate though, if you work in a setting where you don't normally have children, please somehow document or fill out one of those forms where you can kind of say like, hey, this is an unsafe situation, just to cover your butt, right? If you are not used to taking care of children and they are forcing you to take care of children, and you don't feel like you can refuse the assignment, fill something out that basically says your hospital is making you do that, because if you have not been trained to take care of children, you should not be taking care of children, right? They're very different. They, like I said, they break a lot differently than adults do, and you put them back together a lot differently than you do adults, right? So just something to keep in mind. Okay. Let's talk about really quick. We're going to transition into very quick nurse practitioner Liz mode. Okay. We're going to have a brief RSV lesson. If you know about RSV, I'm so sorry. Well, you're going to learn more today. If you have any questions, if you want to leave them, we will try to answer them. I can feel my what is it? My voice. That's what I was. I can feel my voice fine. And admit exactly. Children are adorable little lawsuits waiting to happen. Yes, because you're going to sue over your child if something bad happens. So just be careful. Protect your license. Your license is your greatest commodity. Just guard it, as Adrian always tells us. Guard your license. Do what you need to do to protect it. Do not allow people to take advantage of you in a way that might put your license at risk. Okay, RSV. What the heck is this? Why is this causing so many problems? Just as a brief rundown so that you can tell people in your life when they bring this up, you can be like, well, let me tell you. Okay. Also, brief intermission. I wanted to thank these lovely humans who bought me a virtual coffee, and we'll make them the sponsors of the videos because thanks. Maureen Harmon says, I'm a nurse living alone, but dreaming of my niece's family in central New York. They're starting a homesteading and it's a cool vibe and my favorite place to visit. She left this on a video where we're talking about how homesteading is my dream and I'm trying to slowly do it. So thank you so much for buying me a virtual coffee. I appreciate you. And Chris Tesh bought 3 coffees to keep me very caffeinated, which I very much appreciate. My daughter-in-law, niece, friends, and neighbors are nurses. My son is training to become an X-ray tech, and I appreciate you speaking out. Anytime, my friend. Thanks for listening to it. Good luck to your son. I feel like X-ray tech is where it's at because you can like image them and then send them along their way. You don't have to deal with them anymore. Low risk of getting pooped on. And most people probably aren't too angry at their X-ray tech, right? Like how angry can you be at an X-ray tech? And if they are, they leave. So thank you to those humans who bought me a coffee. I appreciate you. And if, I don't remember what I was going to say, but thank you. I very much appreciate you. Now RSV. Are you ready? I drew something for you. We're going to scooch this way. Okay. This is my virtual notebook. I'm going to pretend like you were in clinic with me. Whenever people had questions, I drew them terrible pictures. So I drew this for you. It's not pretty, but it's going to get the job done. Okay. And then I made them take it home. They always tried to hand the paper back. I'm like, no, that's yours. Go hang it on your fridge. And they were like, oh God. And then you would see them like in the garbage can by the door and you're like, it's fine. I tried. RSV. Respiratory Syncytial Virus. This is something that is going to affect the top half of your body, usually. Okay. And we can see symptoms when we're talking about respiratory viruses. We usually see symptoms you have upper respiratory infections, which is above your larynx, just like right here, your voice box area. Upper respiratory infections and lower respiratory infections. When it comes to RSV, upper respiratory infections, they're not the ones that I'm as worried about, okay? And you don't need to be quite as worried about them either. We are worried about the lower respiratory infections, and this is when we are starting to think like, oh, you may need to go to the ER, okay? RSV, when you think of RSV, I want you to think snot, because snot is what these children and adults have, okay? RSV does affect children and adults. In adults, You can even have severe RSV. Okay. If you have a virus and you are just effusing snot, so much snot, it can be green. Also, by the way, the fact that your snot is green does not mean you have a bacterial infection, friends. It just means that you have gross gunk living up in there. Um, it's not a bacterial infection. Whoever told you that lied. We used to think that actually. I think people legitimately thought that, but it's just simply not true. So RSV, when you hear this, I immediately want to think so much snot, right? Okay. If the snot lives up here, if it's in your sinuses, if it's pouring out of your nose or you're coughing it out, right? And the phlegm is right here or you have a sore throat, I'm not that worried about you, to be honest. I'm really worried about you if this starts happening down here because even though you're making a lot of snot out your nose, right? But that also means that as you get more sick, disease travels down, right? Usually we start getting sick here and I become more worried as all of a sudden you're like, oh yeah, it started up in my nose. And now, like when I breathe, it sounds like a bag of rocks. I'm like, well, that's not ideal. It's now traveled down. So we are worried as it gets lower. As you can see, the problem we start to have with RSV is because we have so much snot, it starts to coat all your airways. So your airways here, we have in your main airway here, that's your throat. That's we're less worried there. Your larynx, not ideal, no, but it's a big tube and you can usually cough that junk out. When you see the lungs initially split off into the two stems, okay, of my beautiful picture, that is your bronchi, okay? So you have your lung tube going down here, and then these are your lungs. I forgot to draw them because they're not important, and I don't draw useless things on my pictures, okay? In your lungs, that's where those two stems are going. The big two, those are your bronchi. That is where adults will get bronchitis. That is because you have a lot of mucus there and they get inflamed and they get angry. And then you see the little sticks, those are your bronchioles. Those are, as air goes down, it has to go through your bronchi and then to your bronchioles. That's where the blood's going. That's what can get blocked up with snot from RSV, as we see. And then the little popcorns on the end, those are your alveoli. That's where your gas exchange occurs. If those get infected, you're looking at more of a pneumonia situation. RSV tends to give you bronchiolitis in little children or bronchitis in adults or some kind of just nastiness in adults in general. But again, we're not as worried about adults because we're usually fine because our airway holes are bigger. Where we run into trouble is when we are little humans, right? Because not only do we have all the snot that is blocking our big airway hole, and then our little airway holes, we also have inflammation. That's the red, right? So that's when you have sinus pressure, you have a sore throat. And then we run into bigger trouble as we go down our airway holes, right? Because we're swollen and we have junk. In children, in adults, we can clear most of this out, right? We have a nasty, hacking cough that produces some truly disgusting phlegm. But again, adults have much more reserve. So we can cough a lot longer than kids. We're stronger, we're bigger, and our airway holes are bigger. So we are able to, they don't get blocked as easy. If you have a little kid who is now having inflammation and snot in these tiny little airways, they get blocked, which is bad because if that little tiny stem gets blocked, then the popcorn air alveoli gets blocked. And then you don't get to breathe because that's where gas exchange happens and the oxygen gets to go into the blood. And if that's not happening, then you really don't feel good. So in little babies, RSV is a problem because these tiny little airway holes, they're so little that there's no room for the mucus and the inflammation. And so they get clogged. They try to cough it up. They try. And they try to like breathe through it. However, once again, since they're babies, we run into a problem. This is your diaphragm, this beautiful pink thing. Normally, your diaphragm is a muscle. It pulls down. That helps your lungs breathe, like open up and expand, and then it goes back up. And that's when you breathe out. And that is how your lungs work. Normally, this is fine. And it does not take that much to make your lungs open and close. The problem is in RSV in a child who you have these blocked airways, your body realizes, oh, breathing normally with my diaphragm and having that pump the machine, right? Because you think of your lungs like a pump, like those baffles. You got to be like the accordion. You got to be like, your body realizes like, I'm pushing the normal amount, but my accordion is not making, it's not doing what it needs to do. It's not breathing for me. We will ramp things up, shall we? And we shall apply more pressure to the accordion lungs. And it does this by saying, diaphragm, you are not doing what we need you to do. We will use other mechanisms, such as accessory muscles. And accessory muscles are all the muscles around your chest, up here, on the sides, and then under. And then you're also going to use your nose. It's going to say, hey, diaphragm, you're doing a bad job. You are obviously not getting this mucus out of the way. We need to breathe. So now we will use all of our chest muscles to also help us accordion in. And this is where you start seeing retractions. And this is where children run into trouble because your body is having to work so hard to try to get the mucus out of the way. It's trying so hard to breathe in and out, and it makes babies tired. So they then all of a sudden decide, well, I'm tired and I'm done breathing. And that is even worse because then you need to breathe to live, right? And that is how babies run into trouble. It's because they have these tiny air holes that get plugged up. Their body says, I can fix this. I'll squeeze my giant accordion and I will use all of my chest muscles, which then their body says, hi, I can't do this actually for very long because this is like a huge workout. I'm opening my nose as big as I can, nasal flaring to try to get more oxygen in to try to help you muscles, but this isn't working, so I'm done. And that is in a nutshell why RSV is so bad for babies, right? Adults, again, can cough. Even if you have inflammation and phlegm in your bronchioles as an adult, it's not enough to block them because you are bigger. In a bigger kid, same thing. 2-year-old versus even like a 3-year-old, huge difference, right? That's why it's more dangerous when you are tiny and why it is more dangerous, like someone said earlier, when you're under 1, because those bronchioles are even smaller, right? So this is kind of our clinical picture of a very sick kid, right? And why we are more worried about RSV in children. Can it make adults really, really sick? Yes. I'm halfway convinced that right now I have RSV on top of COVID because it's going around my daughter's school and she got healthy and then she got sick again. And I think she gave me this second plague. This is why we're worried about RSV in children. Let us see. Here's what you could do about it though, right? Because most children will hopefully not get to the stage where they need all their purple muscles and their nasal flaring to feel better, or they will only need one or the other, or it won't get so bad. Here is what I want you to hone in on. And here's my warning signs that I give all my parents. If your baby is doing usually not just one of these, but some of these, several of these in descending order of how panicked I am. Grunting. This is when a baby is starting to go, when they're breathing, they'll go like, they're doing that to try to, they close their throat. They're closing like their airway. They're basically trying to trap air in their lungs so it doesn't deflate all the way. And they're doing that by subconsciously, obviously closing their like glottis up. But basically just know if your child is grunting, it's not like panic, but it's like, oh, like my child might be in respiratory distress or starting to be. But grunting alone usually doesn't panic me. Again, contact your healthcare provider. But grunting alone, but not the end of the world. Nasal flaring. That's when their nose is going like this. Let me see if I can do it. Oh, good job, self. When they're trying to get air in, and so their nose, and they can like stay flared. They're literally trying to just open their airway as much as they possibly can. Infants are usually nose breathers. Okay. So their body's natural response is to try to open the nose up as much as they can. Also problematic if you're congested though, right? So if you're starting to see these two together, then we're going like, oh, this baby's really not happy. Let's really pay attention to it. Tugging breathing. Tugging breathing is when you start to see the skin underneath the lungs. It literally goes in and under. I will find a YouTube video for you in a minute. It's called retractions or accessory muscle use. If you have tugging under your lung here, I'm the least worried. Okay. That means they're working, but it's bad. If you start seeing their ribs on the side, I'm going, ooh, because before they're using their diaphragm and also their abdominal muscles to try to suck up, right? That's the baby's first thing that they're like, okay, I'm going to try to fix this, right? I'm going to try to accordion and I'm going to use my gut and my diaphragm. And then their body's like, that's not doing it. That's not doing it. And they're like, okay, we'll use my side muscles. If you can see your baby's side muscles, you should definitely call your pediatrician. And the thing that makes us the most worried is when you start seeing their skin literally suck in above their clavicle. So if they're going, and you see right here, like here and here, when they're breathing in, that baby's working really, really hard to breathe, right? You should definitely be calling your pediatrician at that point. If you'll happen all at once. If it is a very, very young baby, could even see the middle of their chest literally cave in. That baby's working really hard to breathe. That should probably be like do we just want to go straight past go and go to the hospital? Not good. High sigh breathing. This is going to be when your baby's like, if it's doing well, it's inhaling. That's stridor, and that's really bad. That means their airway's really swollen. But they will start to do this weird, like, I don't really like that either. That means that their airway is kind of tight and they're like, again, working to try to keep their airway open. And we go down the list. If they're also not drinking, they're probably not drinking because it's hard to drink, right? When you have a stuffed up nose, which also means they're not peeing. I don't care if your kid's not eating, okay? To be honest, because you can go a while without eating. Drinking is very important and we really like you to drink. So if your baby's not drinking or your toddler's not drinking and they haven't peed in like 12 hours, we don't like that. And you need water, you need fluids, you need milk if you're a baby, for your kidneys to keep working and for you to survive. So that's not good. And the worst thing, you have this on the bottom, this has the go straight to the hospital mark. If your baby or child is hard to wake up, and they're we will call it somnolent if they were in the hospital. But if you go and you can't really get them to wake up well, or they went from coughing and being very, very ill and fussy and cranky, and all of a sudden they're laying there very quietly. They're kind of sleeping. They're sort of out of it, but they are quiet. They are no longer coughing. And this was like um, I would get phone calls all the time or of parents, and they were thrilled. They were like, oh, I was so worried. They were, they were coughing. They were throwing a fit. They were really inconsolable, which you get inconsolable when you can't breathe. And then all of a sudden they just chilled out. That call terrified me more than any other because I was like, that baby is exhausted. They cannot fight anymore and they're going to stop breathing. That was the parents that you saw in the ER. I'm like, oh, how'd you get here? And they're like, oh, they were just so sick. And then they just stopped. I'm like, well, that's not good. So if your baby or child is very hard to wake up or went from 100 to 0, it's time to go to the ER. You probably don't even need to call your pediatrician. So this is the list of things to watch out for the 2 internet people who hopefully see this and learn. If your baby is not doing most of these things, you probably can just call your pediatrician. If your baby is doing a first few of these things, call your pediatrician before you go to the ER. And if your baby is not peed in a very long time or is hard to wake up or all of a sudden got very quiet, please just go to the ER. Okay. Hang on. I need to blow my nose. Chad is texting me. He's like, you sound like you're dying. I'm like, I kind of am. Please pause. Gross things you've done on the internet this week. Oh, just blew out all my RSV snot. It's fine. So there we are. Things that you can do to help if you are in this situation real quick, and then we'll see if there's any questions. Let us see. Hopefully that made sense. Did that make sense? Someone let me know. If not, I've been torturing my patients for years with terrible drawings of RSV. I also highly recommend drawing things for people. If anything else, it just makes them realize that you're also human and they're much less scared of you. They're like, wow, you're really bad at this. I'm like, yes, I am. RSV, things you can do at home. Humidifier. That's going to make things more moist. It's going to make your snot not quite as dried up. And if your snot is not quite as dry, you can blow it out easier, right? Same thing for babies. Use a cool mist humidifier for children. So if they knock it over, they don't burn themselves. Saline drops in the nose can also be very helpful. Just tiny little saline drops. They can sell these, or you can buy like a big old jug of saline and just do like little boop, boop, boop. Don't waterboard your child. Okay. Tiny drops, one or two in the nose, and then just slightly tilt their head back. That's going to loosen all the boogers. And after that, you can go in and do nasal suctioning. I put that here on the bottom because sometimes this makes your child so much angrier. Like both of my girls, I couldn't use those nose Fritas or the suction bulbs because they would become so irrationally angry that they then produced more mucus, which made the situation even worse. If your baby is really, really like some babies did better with it because they do breathe easier, but just approach with caution and do use saline drops, or at least have them in the presence of a humidifier before you do any suctioning because a lot more is going to come out. Saline drops have the added bonus of the salt will go in and actually like help make the goo of the boogers a little bit less gooey. It breaks it down just a tiny bit. And it comes out easier. So, fun fact. Fluids in a syringe. This is my favorite tip for babies and young children who do not want to drink because they are congested. Because they don't want to drink out of their bottle, right? Or they don't want to drink out of a cup because they feel bad. You can, and yes, called Ocean Spray. Thank you. You can go and buy it. I was always cheap and I just bought the big things of saline and then got like my 3 milliliter like medicine thing and just put a dot right in both of their noses. But yes, so a favorite thing to get fluids in your baby or child is for a baby, you would put formula or breast milk, pull it up in a syringe, go to the store, go on Amazon, go to Walmart. They have them pull up like 3 to 5 milliliters of the fluid. If it's a toddler, give them whatever they're getting, Pedialyte or whatever it is, and inject it into the side of their mouth very slowly, 1 milliliter at a time if you have to. That way they don't have to drink out of a bottle and they are going to slowly get the fluids, and do this like every 10 minutes. Honestly, that will keep them hydrated, but they don't have to do the work. This works so much easier than just trying to get a baby to take a bottle when they can't, because they can't breathe through their mouth. A baby wants to suck on the bottle with their mouth and then breathe through their nose. This is going to help you keep your baby hydrated when they want to be hydrated in no other way. If it is not a baby, give them any fluid that they want. Literally. It's okay. Normally, like if you're not normally a juice person, juice is great. It'll have they need glucose, give them the sugar. For babies, they will usually take their formula just fine, or breast milk, whatever they're giving them, totally fine, but just do it in a syringe in the side of their mouth, point down. So basically you just take the syringe, you put it in their mouth, in the pocket, right on the side with the syringe tip close to the back of their mouth as possible so that they will naturally just swallow it. Even if they are upset and kind of fussy, don't do a lot. That's why you do like a milliliter at a time. So they're not going to choke on it because it's just like they're swallowing their own spit, right? And do, your 5 milliliter syringe and then wait a few minutes so their tummy doesn't get upset and then do it again. It's pretty much a full-time job, but it's better than going to the ER later because they're dehydrated. And like Scott says, don't give your child alcohol. This is not the 1960s. That's not how we solve these problems anymore. And then the other things are Tylenol and Motrin. Don't give Motrin unless your baby is 6 months old. This will help if they have a fever, if they seem fussy. This is not the time. If I usually tell people to start giving these if they have a fever and they seem miserable and they're not drinking, right? Some people are like, oh, well, like let the fever do its thing and burn it out. If you're no longer drinking, you lose the privilege of having a high fever, is what I would tell my parents, because I need you to drink more than anything, because please do that. So if you are no longer comfortable enough to drink, you need to have some Motrin or some Tylenol in your life, or both. And that's my spiel. Other things that you can do to add to like really flavoring water does worlds of wonders for toddlers, especially 2-year-olds, 1-year-olds. Absolutely love it. Don't give them anything red though, because if they throw up, you don't want to accidentally think that they are barfing up blood. And if you gave them red Powerade or whatever you're giving them, which I tell my patients all the time. And then what did I give my 1-year-old one time when she had norovirus and then I thought she was having a GI bleed? Yep, fruit punch. Don't be me. Even though literally all day, every day, I was like, okay, red is the only color we don't want, right, friends? Red is the only color we don't want because that's not natural. I don't want red. Gave him red. Don't be me. Most other colors are fine because if you barf up blue, I'm like, okay, I know that's not natural. I did that to you. And there we go. So those are our basics of RSV. Hopefully that helps one person have to avoid the hospital. Let me see. Do we have any questions? I can probably answer 2 of them before I go and die. Joe says respiratory stress can worsen with fever. Yes. If your child looks like garbage, having a fever will just make your body have to like work a little bit harder, right? Children especially can spike super duper high fevers. And then you're having chills, you're having other things that just stress your body out more. And again, we don't want to stress those little babies out because they are trying so hard to clear all those boogers out of their tiny air holes. And we want to make it as easy as possible. And if you do need to go to the hospital, you need to go to the hospital. They will be able to give you oxygen. They will be able to give you, they can give you nebulizers. Sometimes you will be able to, from your pediatrician, also get a nebulizer for saline, right? Where they can breathe in. Those can be very helpful for babies. I would prescribe those sometimes for some of my patients. And you can have a nebulizer. They have very cute little elephant masks that they make for babies and toddlers. And they can breathe in the normal saline. And they can get, it'll help break up all that mucus so they can actually cough it out. It's very cute. I do recommend, if you're prescribing that, just call like a pulmonologist or, see what's up. Cause some people also throw in other things into that cocktail, but just ask if you have a child, if that would be something that could maybe help you. Adcomet says, what about chest PT? So this is when you go and you bang them on the back, or their front. You'll see those little cups, or you can just do it with your hands, honestly, to try to make them cough. You can. Hang on, I'm going to get a cough drop so I don't start coughing all over. You can. I don't recommend it because the baby will usually naturally cough on their own. And if you dislodge some gunk in the hospital, we do a lot of chest PT, and this might just be provider preference. But since I saw so many kids, my background was peds. I had done a lot of chest PT on kids where I was pounding on them and then they got a booger, but they couldn't really get the booger out. Right. And in the hospital, you can stick a suction down their throat or down their bronchus and you can get it out. Hang on one second. You don't have that at home, right? So I have no way of getting that out. So I didn't necessarily recommend that you go and do a bunch of chest physiotherapy on your kid and pound on them to try to get the crud out. If they're coughing, you could roll them over, rub their back and pat it. But if you don't have a way to get that stuff out of your lungs, like out of their lung, if they do kind of cough it up, that's not very helpful. So yeah, who said Kate said I have pictures of my daughters with their little penguin and elephant masks when they were little with asthma. Yes, they're very cute. Very sad when they need them, but okay. I can't stop coughing, so that means it's time to go. Hopefully this helped a little bit. I don't know if we accomplished anything other than to read some articles. Lola Noble says, yeah, once it comes up, you have to extract it, and that can be hard at home. So just be careful of that. Yeah, be careful. Go through the list if you're thinking of going to the hospital. This is a real problem, but remember that hopefully the big hospitals will know how to handle it. You can still go. Surgeries might get canceled. You can still take your sick kids. They will still triage them. It's the smaller hospitals that really do make me nervous. So just try to take care of yourself. Don't go into the hospital if you don't need to. Triage all your other things through your primary care. We do not need to be filling up the hospital's emergency rooms with ear infections and other things that can be treated not in the hospital, not in the ER, making the wait longer. Um, like the video and share so my suffering is not in vain. There you go. And if you have any questions, you can leave them in the chat and I will try to answer them later. I'm done. Thanks for being here. I hope you have a beautiful day. Remember that you are not alone. You, my friends, can do you're not alone. Oh man, this is every day I get a fever at like 7. So this is my fever brain. I'm like, you're not alone. You're more than enough. And you, my friends, can do hard things. Thanks for being here. I appreciate you. And I will see you next time. I hope you don't get RSV or the plague. It really stinks. I don't recommend. 0 out of 10 enough. 0 out of 10. Thanks, Scott. Bye, friends.